Thank you, Mr. Chair. So good afternoon, everyone. As mentioned, my name is Jonathan Grew. I'm one of the managers on the environmental health team within the Health Protection Division here at Public Health Sudbury Districts. I'd like to start by thanking Dr. Gurji and my director, Stacey LaForest, for the opportunity to present on this public health issue of highly pathogenic avian influenza. I'm excited to be here. I'll start by providing some background information on avian influenza. From there, I'll get into why it's of public health significance. I'll discuss our local preparedness efforts to date, and I'll provide some information on how we're working with federal and provincial partners to address this issue. Responding to outbreaks of highly pathogenic avian influenza, doing case management and contact tracing of cases, this all falls within our infectious diseases and communicable diseases prevention and preparedness programming. It's focused work under the Health Protection Division. It's guided by the Ontario Public Health Standards with the infectious disease protocols pursuant to those standards. And it also aligns very closely with our agency vision of healthy communities for all. So getting right into it, influenza viruses are highly variable RNA viruses that affect birds and mammals. There's 4 broad types, A, B, C, and D. Avian influenza, or bird flu, as it's known in layman's terms, is caused by a type A influenza virus that naturally circulates in bird populations. And so we see it in wild bird populations that migrate. We see it in poultry, turkey, chickens, quails, and other food-producing birds, as well as pet birds. I want to start by saying this is not a food safety issue. There's no evidence that indicates that properly cooked poultry or eggs could result in foodborne illness attributed to avian influenza. At the same time, consuming pasteurized milk presents no risk. Avian influenzas are very common and have been circulating for decades, as Dr. Gurji had mentioned, but they are closely monitored due to their potential to mutate or reassort. And I'll get a little bit more into that in later slides. Avian influenza is classified by their surface proteins. And so they have H genes, and I'll try not to get too much into the microbiology of it, but there's H genes that generally determine how transmissible the virus will be. And then there's N genes. And there's a possible combination of 144 different types. And the H5 and H7 subtypes are of particular concern because of their ability to mutate from low pathogenic to high pathogenic. And so when we're talking about avian influenza, more specifically, we're talking about the H5N1 virus, but also some of the other H5 and H7 subtypes. When I speak to pathogenicity, I'm really referring to the severity of illness. And so low pathogenic avian influenza causes mild or no illness in birds, whereas highly pathogenic avian influenza causes severe illness and die-offs. Highly pathogenic avian influenza viruses like H5N1 can cause severe illness in humans as well. The cases are very rare. Where we do get cases, the evidence strongly suggests that the exposure that it's due to exposure to infected birds. We haven't seen sustained human-to-human transmission, but this is why it remains a focus of surveillance and preparedness globally for over two decades. It's the risk of mutation or reassortment. So again, H5N1's evolution, potential evolution into a pandemic strain is the pressing concern. I spoke to reassortment, but that occurs when you have 2 different influenza viruses active in one host cell. So for example, if you had a worker at a poultry farm who didn't get their seasonal influenza vaccine, has acquired seasonal influenza vaccine, and then also gets infected with avian influenza, the 2 viruses are active in the host, and during replication, there's the risk of reassortment. That could create a novel strain of influenza that has both the severity of highly pathogenic avian influenza with more transmissibility of human to human, which could lead to the next pandemic of concern. We've seen this in 2009 with H1N1, the swine flu. That was a reassortment of avian influenza, human influenza, and swine influenza. So I do want to emphasize right now, all the evidence indicates that the rare cases we do get are from direct exposure to an infected bird. So what's the current situation globally with respect to H5N1? We're seeing poultry outbreaks with a specific genotype linked to migratory flyways. We're seeing it spread very rapidly across North America and even into South America with severe human cases. Although rare, they're causing severe symptoms. An example of this is recently in November, there was the BC teenager that was positive. That person had severe symptoms but is recovering. And the hypothesis is that the individual was exposed to a wild bird that was infected. In Canada, currently in the last quarter of 2024, there were 84 infected flocks. This was occurring across a number of different provinces across our country. We also had detected H5N5 in a turkey vulture in Ottawa that was linked to Nunavut die-offs. And so I bring that up just to highlight how wildlife such as turkey vultures play a role in the virus's spread. So again, human cases are rare, but can result in serious illness, and mostly due to direct contact with infected birds. There were 60 confirmed human cases in the United States, the one severe case in Canada, the BC teen. And here's where I just emphasizing again, part of our role with respect to advocacy for the seasonal influenza vaccine. Vaccination against seasonal influenza is critical to reduce the likelihood of reassortment, right? The less likely you are to get seasonal influenza, the less like if you're exposed to a wild bird or a domestic livestock that's positive with avian influenza, the less risk of reassortment. Okay, so in order to deal with this complicated issue, a multi-agency approach is required. Whenever there's a positive case in a jurisdiction, there's a number of agencies across federal, provincial, and local levels that initiate a control group to immediately address the issue. Some of the agencies involved are the Canadian Food Inspection Agency, the Ontario Ministry of Agriculture, Food and Agribusiness, the Ontario Ministry of Health, local public health agencies such as ourselves, and other industry partners like the producers, farm operators, and veterinarian associations, things of that nature. So now I'll just spend a little bit of time giving some brief highlights of each, clarifying some of each agency's role. The CIA is really the lead agency with respect to animal health response. They manage a lot of the surveillance and testing of domestic livestock. When there is a positive result, they establish primary control zones, and that's areas where you had a positive result, where they put restrictions on movement to prevent further spread. They issue things like cleaning and disinfection orders, and they also do like depopulation, so culling. And that's where entire flocks are humanely euthanized to prevent spread. They provide some mental health resources and compensation as well to the affected farmers and producers. And they play a lead role in stakeholder communication when we do get these primary control zones put in place. Well, MAFRA, I think it's fair to say, is the eyes and ears on the ground at the farm level. They oversee that these orders are being complied with. They restrict the voluntary movement during these outbreaks. They communicate with owners and veterinarians and producers and people in the industry, and so really support the CFIA in managing and containing the outbreak. The role of the Ontario Ministry of Health, well, they really coordinate between local public health units and our federal and provincial partners. They provide guidance to all the local public health units on human case and contact management. They provide support for testing of human cases, and they support healthcare providers with guidance, essentially wanting to make sure the public health system and healthcare system is all in the same place with respect to roles and responsibilities. And to us now, local public health agencies such as Public Health Severn District, we're really the lead with respect to managing the human health element at the local level. And so whenever there's an outbreak at a farm, or even if it's backyard chickens, regardless of the scale, when there's the risk to humans, we get brought into that control group. We assess the risk and establish any lists of people that were potentially exposed, and we do that contact tracing. We provide guidance to them on monitoring for symptoms. We're involved in offering vaccine clinics and prophylaxis, guidance on when to seek testing and when to seek advice from their healthcare provider for treatment. We also support the CFIA and OMAPA on the ground with respect to ensuring infection prevention and control measures are being followed, and providing that mental health support for operators and workers on farms that are implicated. Beyond our case and contact management, obviously public health education is a cornerstone of our work. And so we do a lot of advocacy to the public and public education on what they can do to prevent the risks to themselves and their loved ones. We also obviously do the seasonal influenza vaccine campaign and advocacy for that. We also do a lot of surveillance. We use tools like Blue Dot, surveillance that we're getting from Health Canada, as well as the Ministry of Health, to ensure our local readiness. So I spoke to that, but a little bit of our work today. So we've participated in a lot of provincial meetings. We've also done a lot of mapping internally, both at the agency level, the division level, and at the team level, so that everyone's aware of what our roles and responsibilities would be internally in the event we get an outbreak in our service area. I don't really think it's a question of if we get an outbreak, it's more a question of when, based on how it's spreading globally, and that's with respect to poultry and livestock. Whether or not we get human cases are rare, but certainly we'll be involved when there's an animal that tests positive. And again, the public education component we're always doing year round, as well as the seasonal influenza campaign. That's all I have for you today. I want to thank you very much for, again, giving me the opportunity to present to you. And at this point, I'm happy to answer any questions that you may have.
Thank you for the presentation and the detailed report. Is there any questions at this time for John?
Through you, Mr. Chair. I understand when you have a poultry producer, an egg producer, the CFIA is involved, there's inspection processes, whatnot, and even when the poultry is processed, there are checks and balances that are in place. But as more and more people raise backyard chickens, what happens in that case? Because that flock can be infected by a wild bird, right? So how are they monitoring backyard producers?
Would you like to respond, Dr. Ritchie? So there's not a lot of oversight with respect to backyard chickens. We would be notified. They would work closely with local associations and industry groups, and they would receive education. And we would really, I think it's fair to say, we would rely on them to notify that CFIA or OMAPRA, and we can arrange and facilitate testing of the poultry. And in the event of a positive result, that's where the same type of control group would still be activated. And there's the Canadian Wildlife Cooperative that'll also go out and pick up wild birds, but also backyard chickens and things like that to offer testing support.
Yeah, Mr. Chair, if I could add a little bit to that. So, I think you've highlighted that there is not the same oversight of backyard flocks. Part of the rationale is that a backyard flock is usually for the owner to consume themselves and maybe some friends and family of the owner, but it's not going into wide circulation of the population. So any risk from that is, of course, much smaller. There is, of course, nonetheless risk. There's certainly the possibility that a backyard flock could be a reservoir from which, infection could then spread to other animals and spread more widely. And That is something some municipalities have taken note, and there are in some cases municipal bylaws starting to be put in place to better regulate those backyard flocks. But in terms of provincial and federal regulations, as you note, I think it's quite limited right now.
Answer your question.
Yes, it does.
Mike, see you have your hand up. Go ahead.
Thank you through you, Mr. Chair, to Jonathan. Great presentation. Thank you. It might come off as a silly question, but I mean, we have small game hunting's fairly popular in Northern Ontario, and we have a number of hunters that pursue grouse. Is there any concern or possibility that the infection crosses into like the grouse population, and that could become a broader concern for things like small game hunters?
Go ahead.
There's always the risk when dealing with wild birds that you could acquire avian influenza, and the risk of reassortment could occur if you're not vaccinated. If you're also active for seasonal human influenza, right? And so there's education pieces that should be done to hunters through hunting associations and different ministries, but yes, there is that concern as well that it could be acquired from those types of birds.
Does that answer your question, Mike? Or do you have
It
a
does.
follow-up?
Thank you. No, that's good. Thank you.
Any other questions from members? Again, thank you, Jonathan, for the presentation. It was very well detailed, so thank you for that.
Thank you.